Who is and who isn't a candidate for TMS? TMS has been FDA approved for major depression only. Major depression is different from just being sad. It's different from having a few bad days. What we're looking at for major depression is a persistent down mood. So the minimum time scale is 2 weeks, and it's usually much more than that. For some people, it's been as far back as I can remember, Doc. So a minimum of 2 weeks, and then we're looking for other things that let us know how deep the depression is. It often affects how people sleep. Either they sleep more than usual or less than usual. It may affect your appetite, either up or down or different. Craving sweets now is a common thing that I hear. It can affect your physical energy level, feeling tired and run down all the time. It can affect your motivation level. How easy is it for me to get up and do the things I have to do, to go to work, get dressed, showered, go shopping, do that project around the house that's I've been meaning to get to, etc. People can become less interested in even fun things. They can often be less sociable, not wanting to answer the phone, not wanting to go out. They can get to the point where they can't enjoy themselves or get excited or have fun or laugh or smile. It can affect a person's concentration and or memory. We can actually see this effect on brain scans. There's a particular area of the brain where nerve cells are being born and dying, which is different than some of you older folks learned in high school biology, where they told you you're born with all the brain cells you'll ever have and it's all downhill from here. There's no brain cells being born in the brain. Not true. It's one particular crucial area called the hippocampus, which is a main memory center, where there's a lot of cells being born and dying, actually. And what happens when people get depressed is that the birth rate goes down. And the death rate doesn't go down, the birth rate goes down, and as a result, the hippocampus actually loses volume, and we can see this on scans. The good news is that when the depression is treated, the hippocampus gets back up to its normal size, but we see, literally on a scan why people have memory, and it's probably also a large part of why people have concentration problems. They can lose like 10, 15 points off their IQ just by being depressed. Depression can also affect a person's libido, their sex drive. It can cause feelings of guilt, and what concerns us the most is when people feel like life isn't worth living. I just wish I would die or get hit by a bus. Or even more so, people having actual suicidal thoughts, a wish to kill themselves. So that's what major depression is. That's what TMS is approved for treating. It's actually being looked at for a number of other things, including substance abuse, post-traumatic stress disorder, obsessive-compulsive disorder, some things that aren't strictly psychiatric and more neurological, like tremors or Parkinson's disease. Basically, because this is a treatment that can focus on a particular brain region, and as you may know, different regions of the brain are responsible for different functions or activities, or senses or perception. Depending on the frequency that we use, which is usually 1 pulse per second or 10 per second, we can turn down the activity level or up the activity level of that area, which is why we have a reasonable hope that if we do more research, we can prove that TMS is actually useful for more than just depression. But that's for the future. Right now, major depression is what it's approved for.